We are now going to shift to clinical wellness, how the medical and the wellness world are beginning to work together in a more integrative way, or are they? To lead up this wonderful panel, exciting panel, we have Jeremy Abbate, who is the publishing director of Scientific American and the leader of all of the Scientific American branding and media. He is renowned for merging, synthesizing the best of medicine and wellness trends and giving us the most thoughtful views on how this integration will take place in the future. Please welcome Jeremy Abbate. Sure, and you'll call up and introduce your panel. Wonderful, thank you.
Thank you, Giselle, for that warm intro. I don't know who wrote it. So we're going to talk about the world of wellness and the world of medicine, working together, coming together. So we have the doctors in the house here today. It should be a great discussion. I'm Jeremy Abbate. I'm the publisher of Scientific American. We just did a special issue a little while ago called The Secrets of Staying Young, one of the best sellers we ever did. We interviewed a woman who was, we basically looked at some strategies that people that have lived a long time were doing. And one of the women that we had interviewed years ago, she has since passed away, was Jeanne Calmet, the French woman who is the oldest living person ever recorded, or whose age could be verified. And she lived to 122 and was pretty healthy to 122. She remembered, her parents had a painting store in France. When she was a little girl, she remembered this irascible, gruffy guy coming in to buy paint. It was actually Vincent van Gogh. True story. True. I'm not kidding. So when asked to what she attributed her longevity, she named three things, all of which are decidedly a little bit unmedical, but I think she had some good doctors along the way. The three things she noted were olive oil, wine, and laughter. I'll take them, right? So, great prescription, right? We've got a real powerhouse panel. We don't have a lot of time, so we're going to talk really fast. So use your translation headphones. Before I start introducing the illustrious, esteemed panel, I want to throw out one quick philosophical nugget here. In 1946, when the World Health Organization was formed, they set down a definition of health, one that I thought we could revisit here. This definition was part of the preamble to the World Health Constitution, adopted by the International Health Conference in New York, June of 1946. And if we can think about the state of the world in 1946 and what we had just been through, I think this definition resonates very nicely. I also feel it's a definition that may have gotten lost through the silos of the 20th century. So I think maybe today, and I think represented by the people here, we might reset and work toward this definition. So let me just read you what the then newly formed World Health Organization defined as health in 1946. Hey, there's me. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And I like that holistic approach to it, and I think it's very powerful, particularly when you think about the state of our world in 1946, and you could certainly, we are not as enlightened as we probably should be, because we are still in a globe that is experiencing conflicts everywhere, every day. But I can imagine that perhaps we're at a point where we are truly integrating the experience of health in every sector, and I'd love for this panel to explore that. I'd love to talk a little bit about wellness trends and how what we consider traditional medical interventions addressing the larger picture of health. So I'm going to introduce everyone how they're listed in the program, so just give a shout out, and then we're going to ask everyone to just situate this from their perspective for a few minutes. So we have Tom Gubanc, the Senior Director at Cleveland Clinic. How are you?
Thank you. It's an honor to be here. We are the group within the Cleveland Clinic that is that wellness group that's working within the medical group. My area does work with employers nationally and globally, and really our philosophy is trying to, number one, get people, the individuals and employees, to have an emotional response to know that they can make a change in their lifestyles. There's just a growing need for people. And they're all in different phases of their life and at different points in their journey. So we work hard on that engagement. We also work on the culture, making sure that the culture will drive the employees to feel empowered to make that change. And we work hard on research and as well as environment, which is really interesting, and making it hard to make poor choices at work and making it easy to make healthy choices while they're there. Thank you.
Great. Next to Tom is Dr. Adam Perlman, Associate VP, Duke Health and Wellness, and Executive Director, Duke Integrative Medicine. Hi, Adam.
Thank you. I guess what I wanted to say is that it clearly feels like we're at an inflection point. And to me, this feels like it's sort of the second wave of interest in kind of integrative health and wellness from the conventional medical perspective. The first one was in the mid to late 90s, shortly after some research from David Eisenberg out of Harvard came out looking at complementary medicine use and 1/3 of Americans using complementary medicine. You saw a whole wave of integrative centers open up at that point. And then very shortly after, a whole wave of them close. I think because there wasn't really a fundamental commitment to the principles of sort of integrative health and wellness and well-being, and just more of a desire to capture some of the out-of-pocket money that the Eisenberg study had identified that people were spending on complementary medicine. This time it feels very different. At Duke, I oversee 3 main units. Duke Integrative Medicine. We have a 27,000 square foot integrative medicine program. I oversee the Duke Diet and Fitness Center, which has been around for 40 plus years, which is a residential style weight loss program that's really about lifestyle. And then a fitness center on our Center for Living campus. And I would say that when I got there 4 years ago, those units were still quite siloed from each other, siloed from the rest of Duke, and certainly siloed from the rest of the broader system, either nationally, regionally, nationally, or internationally. And that's what's really begun to shift. And I think it's happening for a couple of key reasons that really, to me, speak to the fact that this is not just a trend that's going to be gone tomorrow, but something that's really here to stay. I think first and foremost is that the incentives are now in alignment. And what I mean by that is that healthcare is shifting, certainly in the US, and I think to a large degree worldwide, in that we're shifting away from purely a disease management system where we're waiting for disease to occur and then getting reimbursed, quite frankly, for treating that disease. We're now being asked to take on risk. We're now being asked to manage the health of populations. And that really shifts the equation, and it shifts the business model and the value proposition for health and wellness, for many of the things that you do and the things that I'm particularly interested in. I think the other piece is that we're finding an increasingly more competitive marketplace, again, certainly in the US and I think abroad as well. A couple of things are going on there. One is that the traditional payers are now getting into the providing of care side of the equation, so that's making things more competitive. Certainly the Dukes of the world are seeing that, as are others. And I think the other thing is that the patients are demanding a different kind of experience with healthcare, and they have more choices. The health exchanges are going to provide more choices to patients, and healthcare systems are sort of looking internally and saying, do we provide the right type of experience for our patients? And the answer typically is no. And then again, when you look and say, well, where within the realm of sort of health and well-being do they do a great job of providing the right experience? And again, it's looking out to sort of the spa, wellness space where experience, I think, has been the key from day one. So I think that has created this level of interest and willingness to engage that we didn't see prior to just a few years ago. So I'll maybe stop there, but thank you.
Great. Next to Adam is Dr. Juliet Skinner, co-founder and medical director of Barbados Fertility Center in Barbados. How are you? Welcome.
I'm good, thank you. So likewise, it's a pleasure to be asked to be here by Susie and her team. I'm a really small part of, I guess, this question. Barbados Fertility Center started in 2002 with a core vision that what we wanted to do was provide individualized care, and we wanted to also do that in a stress-reduced environment. Our logic was, when is it best to reduce your stress? But at the very beginning of conception. Surely it would have to have a benefit. Barbados is a very tiny rock in the Caribbean Sea that has a population of 250,000. The simple maths of an IVF unit are you need probably about 750,000 to make it function and financially possible. So we knew from the beginning that our patients were not going to be locals. And really for the last decade, 85% of our patients don't live on the island, they come to us. And if you like, are forced into a stress-reduced atmosphere because they're in a holiday mode rather than actually in a conventional mode. We further expanded on that where we facilitate the additional stress reduction through massage, reflexology, acupuncture. And our patients have the choice to take that or don't take it. And I think that's important as well. If you ask the key question, which is, well, how does this affect the outcome? If you ask the question in terms of patient experience, it's a resounding yes, it's for the better. And so many of our patients have had an IVF treatment before they come to us. So they know what it was like in the alternative option. And I think they're really good teachers to show us and say and give their experience of how comparable that was. If you ask the question in outcome, because you might think, oh, that's really simple, the outcome is that you either end up with a baby or you don't. There are so many compounding variables in IVF, maternal age, quality of eggs, ovarian reserve, to the probability of success, that it's difficult to sometimes get those true answers. But if you do drill down and you do take out maternal age, and you look at only the under 35s and you look at 2 embryos transferred, we do see a difference. And we definitely see for those patients that opt in to doing the massage, the acupuncture and everything else, they do better. And I think that's the take-home message, that we can work together on this and improve better success.
It's a thin slice of it, but I think an important one, which we will explore in a moment. And next to Juliet, keeping with this global theme, is my old friend Josef Woodman, the CEO of Patients Beyond Borders, who definitely sees health and wellness from a world perspective. So, Joe, how are you? And what do you think of this forum of medical versus, it's not even versus, okay, so I'd love to hear your perspective on this.
Well, I've had the great privilege of having a little bit more of a global perspective, having been forced into this medical tourism environment and traveling the world in the 7 seas over the past several years, being in and out of more medical centers, wellness centers, traditional Chinese medical centers, and I care to admit, and I think I've had a rare opportunity, especially as a non-clinician, to really take a look at some of the healthcare models. I deal usually at the ministry level, whether it's in a Singapore or a Turkey or a Caribbean island, and there are some pockets of hope out there. It's been repeated over and over during the course of this first day. Some of the problems in the United States, 18% of our GDP is spent on healthcare. One of the things that occurs to me when I hit ground at JFK or in Miami, it doesn't take many steps into the terminal to see that we've still got probably one of the most unhealthy populations on the planet. And so it shouldn't be too much of a surprise that we also are way ahead in figuring out wellness strategies and preventive care strategies because we're forced into it. We cannot afford to have such an expensive healthcare system any longer. So, on the one hand, there are models that are pockets of hope. Scandinavia, Singapore, South Korea, where for half of the cost in terms of GDP, these are industrialized nations that keep their populations very healthy, relatively happy, universally, and at fairly low cost. So in a lot of ways, we don't have to reinvent the wellness wheel on the one hand, but on the other, because we're in so much trouble in the United States, it's really interesting to note how far ahead we are in our workplace wellness programs, in our preventive care programs, and in our integrative medicine programs. My passion would be to see that translate to other areas in the world, emerging nations. There's 150 million fat Indians in India. That's more fat Indians in India than there are fat Americans in the United States. And most of that has to do with childhood obesity, which is on the rise, not only in India, but in China and Latin America, and even Southeast Asia. So my vision, and I think our vision, would be to work not only in our own country, but globally to accelerate the process of wellness and preventive care so that other countries who are emerging very rapidly with much larger populations don't have to spend 60 or 70 years fixing the problem. So
We'll explore that a little more. And next to Joe is Dr. Karen Koffler, Medical Director at Carillon Hotel and Spa, formerly known as Canyon Ranch, where I had the best oatmeal ever in 1998. I did. How are you? Welcome, and thanks for being part of the forum.
Thank you. So my current work environment is a combination of medical wellness. The lens that I use is primarily functional medicine and integrative medicine, and we work side by side with the spa team, which includes the massage estheticians and the fitness team. And my observation is, first of all, people love, of course, leaving their lives and coming to a beautiful location and really focusing on themselves. The people that live at our property do the same thing. But the issue that I'm seeing is that the way medical thinks and the way spa thinks, there's a schism there, and what medical would like is for spa to use a similar language, and what I suspect spa would like is not to necessarily have the same restrictions on them that we experience more in the medical world. So finding common ground there where we can work together and actually use each other's services is really our focus at this point. The other piece I'd like to add is that there is a hugely growing population of physicians that are completely exhausted by the system that we've allowed to be created. I teach for the Institute for Functional Medicine and recently taught at a 500 physician conference, and they're all expressing the same thing. They all really want to get back to the roots of medicine and really actually provide health care. So much like Joe was talking about, there's a lot of pockets in the medical world. A lot of them are isolated, but growing in number.
Great. And last but certainly not least, Dr. Paul Limburg, Medical Director, Office of Wellness for a small little organization, the Mayo Clinic. So happy to have you join us today.
Thanks, Jeremy. It's a real honor and a privilege to be part of the panel and part of the conversation. I'd just like to thank the organizers for having this be part of the program. Clearly, it's a critical issue. I think all of us in the room would recognize that the system is broken and we need to each play our part to try and do what we can to fix it. At Mayo Clinic, wellness, prevention, whatever terms we've used, have been part of our foundation since the Mayo brothers started our organization dating back to the 1920s, language around wellness and teaching people to do a better job of taking care of themselves so that they can help others. I think as we've moved in the last 20 or 30 years, we've accelerated our path into some of these different areas. We are based on a team-oriented approach, and I think that we would extend our team-oriented model well beyond the traditional physicians, nurses, other kinds of caregivers into those spaces where many of us represent in the discussions today. I think in terms of how do we do a better job of looking at not just health but well-being, our mission at Mayo Clinic actually calls this out. We are, our goal is to inspire hope, but also to contribute to health and well-being to people around the globe. We think that we can do that in multiple different areas. For our own employees, we've got some creative programming that we've applied on our own campuses, much as many others have done. For our patients, we're starting to move in new directions. We've got a healthy living program, which is novel and it is different than anything that we've offered in the past. That opened 2 years ago. And we're trying to deliver our knowledge out through partnership opportunities, through our website, through our books and those sorts of activities, so that knowledge that has been born out of 150 years at Mayo Clinic can be delivered to anybody, anywhere, and not just to the patients who come to our campus.
Great. So in the interest of time, we're going to go right to the lightning round here. So I'm going to join the discussion and I think just pick up some of the points I've heard. To me, and I think probably to most people, health is something that is by its nature a holistic issue. And I feel that health solutions are kind of like a toolbox. You know, we develop interventions at every level. Like a toolbox, some jobs require a hammer, some require a saw, some a drill. I was talking to Joe yesterday over lunch. I mean, if a brick wall fell on someone and they needed a bunch of broken bones set, we all know what the intervention would be. We'd probably go to a more traditional Western medical intervention. But if that person wandered into the brick wall because they were dizzy, they were stressed, they were tired, you know, they had other macro factors affecting them, that's something obviously that's more the purview of these larger forces in managing health and life and stress. So my question, I guess, and you know, Adam, I'm going to put you on the spot here because we talked a bit about this last night. Why are these worlds sometimes so different? I mean, no one on this panel, you guys are all in the integrative space. No one is going to, it's not like this is a point counterpoint. We are all emblematic of this integration. But why do you think, Adam, that there are these two worlds and there are still some skepticism? I mean, I see optimism that there's a de-siloing, but there's still obviously, to your point about the spa world, there's still obviously a little bit of a separation. Are we starting to come together?
Well, there was a lot of questions in there.
You know, pick one of them.
I was good with the two worlds and coming together. That's like a whole nother one.
Wherever you want to take that.
Yes. No, I think that, I mean, historically, a lot of it, I believe, has to do with the way that we got reimbursed. I mean, there's a Chinese proverb that isn't exactly true, but that the Chinese doctor gets paid when the patient doesn't get sick, right? And, you know, the reality is that I get paid for treating disease. I didn't, at least historically, get paid for preventing disease. And so one could imagine, I mean, given that was the business model, that, you know, we had this sort of approach that was basically about treating disease and being focused on pathophysiology. What I think is shifting now, as I've said earlier, was hopefully moving away from a purely disease management model, is we can't be satisfied when the hemoglobin A1C is back to normal range, or the glucose is in a normal range, or the blood pressure is in a normal range. Those are very important goals because they have long-term health ramifications and things that we need to do for patients. But just because those metrics are back where they should be, doesn't mean that the person can get on the ground, play fire trucks with their grandchild and get back up again. Doesn't mean they can take a walk with their spouse or do the other things that are important to them. And as we throw this term around, patient-centered care, and I think people define it many different ways, and you know, I think often don't even know what it really means. But at least for me, it means taking off the label of being a patient and recognizing that we're talking about people that have their own goals and dreams and values, and what can we do as a community to help those in need to sort of reach their potential as it relates to their health and their well-being.
So we're redefining, Tom, I want you to pick that up. We're redefining the metrics to evaluate that long-term success of the intervention, while we're also redefining the very nature of what a patient is. Tom, what do you think of that?
Well, I mean, just to kind of second that, because we've been at this for multiple years, it was at the beginning, just take care of the sick. You know, look at an organization, find out the well and the sick, and put in disease programs, create that model. Now what we found out is that, good, we were helping the sick, but 10% of the well were falling into the bucket of sick. So now companies are crossing that line to say, let's invest in the well and prevent them from falling over. And oh, by the way, now we're really treating the entire organization, and we're creating more of a culture of wellness.
Right, and that's economically driven as well as socially driven as well. Juliet, I want to talk to you about this case study because I think there's an audience that represents a diverse range of stakeholding within this larger enterprise of health. You have got some fascinating, albeit small sets of data that would suggest in the realm of fertility, you're seeing that the sense of place, the sense of a relaxed spirit, if I can use the word, has direct clinical outcomes. What does that potentially mean for other areas of spa and wellness, relaxation techniques, mind, body, mindfulness? I mean, it sounds to me pretty exciting, and maybe this dialogue is pretty important.
That concept was the core vision, but at the same point you say, you want to see data come out at the end of it to say, well, we are doing the right thing. And what we did was we looked at our success rates, and I think one of the challenges is so much that's been published on, take acupuncture, for example, on IVF outcome, didn't take out the variables. And I think you've got to understand that as a core, that as I said, maternal age, markers of ovarian reserve, previous failures, multifactorial causes to their infertility, all really, really affect the outcome and the probability of that patient becoming pregnant. So if you just put them into two boxes, you're not going to see the difference. And I think if you actually look at the patients who actually choose the route of adding complementary therapy to their care, they're actually statistically less likely to probably be in the predicted success group. So despite that, they're doing better. And I think when we drilled down to our data and we looked and said, okay, let's take the two things, the biggest variables out of that, maternal age and number of embryos transferred, we saw about a 5 to 10% difference in success, which in IVF terms is huge. And as I said, and that's despite the fact they're in the poorer category. Mm-hmm. So, I think that it makes sense. And I think that our strategy is also about individualized care. And I think it comes back to really the point that we're all making, which is let's bring this back to patient care. Bring that back to your definition. And it was interesting that the words being used in 1946, were, the mental, the physical, and if you like, the overall well-being. And I think we've all got to remember that it's not just the 7 minutes, this was a discussion at lunch, that is spent with the physician and the patient. It's about educating that patient that they can then take part of that care. Mm-hmm. They have to control it too, and understand it.
Well, Karen, can you pick up on this a little bit, just in terms of what you see as the significance of this holistic view of health in terms of how it's delivered? And I'd also like your opinion coming from an enterprise that has been associated with a rarefied, wealthy few, the idea of access and democratization of this, and how the lessons learned on site can be then disseminated more into culture at large, the world at large.
Okay. All right, where do I start with that? So your first point, the integration, yeah?
The integration.
Well, it was, I'm a good example of the challenges because when I first got to Canyon Ranch, I saw the spa as the pampering side, and it was put out that way. But the medical team with the acupuncturists and the exercise physiologists and physical therapists, we were the ones who were doing the work. We were the ones who were making the real shift. But the fact was that people were going to the spa in greater numbers and leaving satisfied in greater numbers, it seemed, because it was an immediate effect, and our work takes a little bit longer. So I actually had to come to grips with the fact that, that I wasn't the be-all and end-all, and our team wasn't the be-all and end-all, and that we needed to work together. So that it came through sort of hard lessons. And so that side of it, the ability for instance, the spa team to really touch the patients in the way that they do, and our side of education and the ability to connect dots for patients actually works incredibly well. How do we bring it out to the masses? I think it's happening. Zeal and Massage Envy and companies like that now make what was once what a rare few people could enjoy, now very commonplace, more and more commonplace. And just the sheer numbers of people who are being educated in different realms of integrative medicine, people are able to access what it is that we're doing. I think what doesn't happen is coordination. And I still think that physician involvement is important. I don't think it has to be a medical doctor necessarily at every point, but I do think there has to be some quarterbacking and some conversation happening, as opposed to people getting random care, which is what a lot of people end up having to do.
Right.
Paul, would you say doctors are trained enough to take in what is now these integrative trends? There was a big report, famous report, I guess, on NPR last year about the lack of nutrition training that doctors don't get. How does this integration affect what medical schools teach? And in fact, to your point, Karen, what does it mean for that equation of health delivery? Is it just going to be a doctor? Is it going to be others that have training in these certain areas that might be more relevant for the therapeutic value at hand, depending on the condition?
Yeah, a great point. I do think that we can always do more with training. In some ways, information overload is a problem that we're all faced with. We were talking a little bit over lunch today, too, that if you only have 7 to 8 minutes in a primary care visit to talk about a myriad of topics, all the education in the world isn't necessarily going to fix that problem. So I think research is important to us, understanding what it is that we can provide, understanding what that individual person's needs, be they a patient, be they an employee, a consumer, whatever name we call them. We like to use the term health seekers at Mayo, but understanding what they're looking for in that relationship, I think, is also key. And to the point about, how do you define the toolkit? Well, first you have to understand what issue you're trying to address or what problem you're trying to solve. And then it becomes easier to say in a post-surgical patient, do I just use medications or would massage therapy actually do a better job? And we're finding through, I would say, robust research that massage therapy actually can reduce the amount of medications that are needed. So they fit together hand in glove.
Yeah. There you go. Look at that. And you wanted to find the back door in case it was a hostile audience.
Yeah, exactly.
They're clapping for you. Joe, talk about the economic drivers of this. To me, I feel like, and I think everyone can agree, the idea is access. The idea is that all health solutions, when you look at the inequalities of the world, hopefully health solutions can eventually become democratized and access can be gained. It starts certainly when you look at the development of drugs that are very expensive and they become generic and they become more accessible. You've spent a good deal of your career mapping where healthcare is delivered and what the inequities are. Talk a little bit about what are the economic drivers of this integration? Challenges
Do I look like a doctor to you? That's a good one. That's not a sound bite. I notice the term prevention has come up in this summit more than in the 2 previous summits.
What's the term, sorry?
Prevention.
Prevention, yes.
And, and lifestyle management. And then if you're at the government level, population management and economic wellness, all of these points have come up. Susie mentioned prevention twice in her introductory address. So certainly if I'm understanding your question correctly, from an asset standpoint, it seems to me that, and I'm talking more at the government level, at the macro level, it seems that governments that focus on, keeping, it just seems like a no-brainer. And people, just keeping people well in the first place, keeping people out of hospitals. I was on a plane I was in Izmir on the way to a conference, and I met a woman on the plane who was heading down. She was from Norway, and she had severe arthritis in her hands. And every year, the government sends her down to a thermal bath resort. Not the sexiest, but she sat in a thermal bath for a month out of the year, rather than having the government expose her to multiple unsuccessful, delicate, expensive hand surgeries. So that's one piece of it. I think you've got to look at a balance between allopathic care and other forms of care. I love the way that a couple of hospitals, one in Taipei and the other one in Seoul, they were established around the turn of the century. And they were real-life hospitals with people running around in white coats and stethoscopes, but they basically, their core was traditional Chinese medicine. And then when allopathic Western-style care began to move into that hospital, then that care had to be integrated into the existing traditional Chinese medicine. And there was a lot of resistance to that. But there was also a lot more teamwork and a lot more acceptance. And I think that's one of the things that we all, and I think everyone here, is striving for, is to get more teamwork and more integration and make integrative medicine truly integrated within a medical community.
I feel it kind of mirrors that idea that within the 20th century we became a bit siloed. And in other aspects of medicine, I'm seeing us going back 100 years. I mean, the popularity of using leeches and the focal infection theory. Adam, do you want to talk a little bit about in this new era of integration, we're also looking back a bit to some of those ancient arts and saying there was some real value there, and we should maybe think about codifying that and measuring it in a way now, using modern tools to look at things that were once thriving parts of the larger health equation.
Yes, I mean, there's clearly an openness, is the way I like to think about it, to things that often come from other healing traditions. I think what is driving that is that we've recognized that we can no longer spend the money we're spending on sort of the high-tech solutions and the medication solution and the surgical solution. It's not getting us where we need to be. And so I think, there's a real openness now, which I think, puts a lot of responsibility on all of us. I mean, what I see is, the people that run our health system, and I think others, when I talk to other health systems, sort of the C-suite is saying, okay, well, you've been talking about this stuff, now I'm open to it. Where's my value proposition? Right. What's my ROI, as, Ken was talking about? And we haven't really done, I mean, short of some of the work that Ken presented to you, we haven't really done a lot of that work for numerous reasons. I mean, so we don't have a lot of that data. I think we need more pilot projects, more data that show we bring value when you take this approach that's more open. And value in healthcare is defined as, outcomes, quality outcomes over cost. We need to show what we really can do.
So what has to be done to make this integration reach down more to the consumers? Tom, you want to talk a little bit about Cleveland and, certainly getting companies interested, but also opening up dialogues between what have been traditional providers of medical care with those purveyors of health solutions that are more in the spa and reflexology and massage world?
Well, I think, the science of what we're doing, the trick is to almost consumerize it so that, a lot of the science could be older, still proven, but if we could wrap it up in an engaging way, either a technology or a approach to rolling it out within an employer, it's going to be more effective. So those things, the evolution of the mobile space and how the mobile apps are leveraging artificial intelligence to get better and better and learn from the experiences of the past users, those are the ways that not only are affecting the consumers, but can get taken back into corporations for success.
No, it's interesting how this evolution happens, and you kind of, things evolve and you feel they're success stories. You look at antibiotics and some of the, I was a few weeks ago with one of the inventors of Gubanc, of a huge success story as a cancer drug. But even the, people like that. I was talking to Lee Hood, the biotechnologist, and he's forming a wellness company because he's saying that the tools of big data, the tools that modern science are giving us, actually have a huge value in looking at this holistic approach to health. So Lee Hood, a guy who was the father of biotechnology, helped to found Amgen, he invented systems biology. He is using these incredibly powerful genomic data tools to look at things like biomarkers and, to pinpoint how stress affects these different systems. So I would think that in this age of big data and high tech, those could be used, again, in that de-siloing way, in the service of linking the worlds of traditional wellness with medical innovation. I mean, do you think that's, I don't know, kind of like a simplistic way of thinking about it? Or technology, we have to be just as skeptical of it as embracing of it. And do you think there's an opportunity there, or?
Definitely. I mean, just to be able to provide that physician who only has 7 minutes to bring them all the options and the effectiveness up from a single click immediately, has to provide that knowledge to that physician to say, boy, these are all the things that are available to you to improve your health, and here's the effectiveness from the past. Why don't we try this approach?
Right.
Even to your point, though, if I can just throw in here quickly. This thing's on. No, sorry. All of our understanding, I mean, we thought after we cracked the human genome that we would have cured all these diseases by now, right? And so now we know that it's more about epigenomics. But when you look at the data out there, the strongest epigenetic modifiers are lifestyle.
Right.
It's stress, it's sleep, it's whether you exercise, what you eat. Massage therapy is an epigenetic modifier.
Right.
So that again, I mean, the science is sort of again shifting us back towards looking at lifestyle, wellness as being the core to what we need to be focused on.
And this whole idea of I'll get to you in a sec, Joe, the idea of the patient, what's been known as the patient empowerment movement. Dr. Eric Topol of Scripps, he wrote that book, The Patient Will See You Now, about the changing, mainly about technology, but also this cultural shift where patients have more choices. And payers will give them those choices once they're convinced there is an outcome value there. So that's obviously an economic driver of it. And then you have this idea that patients can say, you know what, I maybe can't pinpoint why, but I feel better having had massages or acupuncture, and it goes into this holistic equation of long-term health. I mean, what do you think about that? Is the patient empowerment part of this as well? Their choice? That can be for anyone, Karen or Joe?
Absolutely. And patients now are radically different than the way they were before. They want to be, at least the people I think that end up coming to us, want to play a role in their own healthcare. So it's up to us to get to know that patient well, to understand exactly how to personalize their treatment plan. So we used to name their issue and blame it for what we're seeing, and that led to a certain drug. Now, those of us practicing this kind of medicine have left that framework behind, and we are seeking to understand the individual. And genomics, lifestyle, and environment are the interplay of what makes this person show up with this particular constellation of symptoms. You were going to say, Joe?
No, you took the words out of it. I do think that the rise of the patient, the informed patient, we've seen that if a patient's only got 7 minutes, they really need to come in informed. And I think what we want to more see is a patient having, within a medical community, having a smorgasbord of choice, where it's not, if it's cancer, it's not just chemo, surgery, radiation, where it might be a whole smorgasbord of strategies that have been clinically tested, and the patient can begin to make his or her own decisions. It'd be like a marketplace of care. And that hospitals, I envision the day where a hospital may not even be thought of as a hospital, just a place where people are not only gotten unsick, but a place where they can be, their wellness.
Yeah, I mean, that time spent is a great concept. Again, going back to this idea of learning from the past. In the old days, the idea of the country doctor, knew the family members, knew the history. My grandmother just passed away last year, about 99. And she outlived her doctor. I mean, she had a doctor for 55 years and knew everything about her and her family. And I feel like again, what's happened over the past 50 years, in most cases, Medicine Inc. kind of shifted, and of course, in 7 minutes, when you may not even have seen this patient for a year or 2 years, it's hard to thin slice a diagnosis or see what the macro factors are. So is this integration also about getting to know the patient in other ways, or at least delving into some information that we might have not thought as relevant years ago, and now we're realizing there's a bigger picture here?
Yeah, so I think it has to. And we're seeing, as we heard from Zeal this morning, that there is a shift to house calls in many, many other industries. Zeal Clinical maybe is a little ways away, but I think we do have to understand that it's the patient that we're trying to identify their needs and meet their needs, and I think we have to do that in markedly different ways than we do today.
No, it's interesting, the idea of coming to them. You know what else is on the rise? Milk deliveries. So again, kind of a bellwether of how the service industry looks at their constituents. Juliet, you've been very quiet.
I think it's bringing it back to patient care, and I think in patient choice. And as I said, in our field, 50% will choose to have additional treatments.
Yeah, well, I'm optimistic about this integration. I mean, again, like I said in the beginning, we've packed the court here with people that are obviously seeing this. It's what you do every day, it's your passion, but I'd like to, obviously this is, as Susie said, the beginning of discussions, not the end of discussions, but the red light means it is the end. I'd like to throw down the gauntlet for the rest of the summit and beyond and say I'd like to certainly have everyone, I mean, we don't have a formal Q&A, but would love to hear other people's thoughts after this event, because I'm excited by this. I feel like there's obviously pockets where this is very successful, and integration might not even be called integration in the future. It will just be called, health. So let's see how the definition progresses. But I want to thank every one of these amazing panelists. I want to thank Susie and Nancy for organizing this. Great job. Pleasure and an honor to be here. Thank you. It was awesome.